patient came to me this week, and I met with him when we discussed old times. He's 87, he's widowed, he has 6 children. And while we're talking, I asked him about his lungs and his kidneys, and he told me that he had a mass in the kidneys and a mass in the lungs. Diagnosed last year with kidney cancer, spread to the lungs, and his doctors told him, everything's okay. He didn't have any treatment, but everything's okay. But to me, that's a little bit hard to believe. Sometimes you believe the patient. Well, it's not that the patient was not telling the truth. He wasn't being told the truth. And I called up the head of radiology at this facility and spoke to him and asked him, well, what about the kidney and what about the lung? Yeah, it's right. He's got a kidney cancer and a lung metastasis from the kidney cancer, and they've both grown by 30%. And the patient was shocked. So he's 87, prostate cancer. I treated him 15 years ago, high-risk cancer in remission. Now comes with this forehead, ear cancer. They're going to cut off half his face. He asked, can you help me, Doc? I said, yes, I think we can help you. I think we can help you get rid of this, put you in remission, and leave you with your face and your ear. Doctors had already cut off the top part of both ears from skin cancer. So he was already deformed, but losing the whole ear and the side of face is a lot different than just a clipping of his ears. So he said, let me get going with this skin cancer. And I said, okay, but please don't forget the kidney and the lung. And I think he's more focused on the skin because he can see it and it's bleeding and it's difficult. But the cancer in the kidney is just as important. It's already spread to the lungs. And our success rate in stopping kidney cancers is about 90% non-invasively. My son, who's a young doctor, just analyzed our data for lung metastasis from kidney cancer, and we've treated many patients with kidney cancer metastatic to the lungs, and our success rate in stopping or shrinking or making those lung metastases go away from kidney cancers, about 95%. So the success rate is very high. Gil Lederman is presenting that data at an upcoming meeting. So for this man, the prostate's in remission. The kidney cancer lung needs to be addressed, and he wants to get started with the skin, which we've already done, and will commence treatment this week. There was also an article, which I don't want to forget about, the CEO of Aetna said this week that Obamacare rates are going to increase about 20% in 2015. So I remember back being told we weren't going to spend an extra dime and you can keep your doctor, and now it's another 20% for 2015. Wow, that's something we don't need. I want to talk about another woman who came to me. 77-year-old married woman came with her husband with an esophageal cancer. They actually came because they were listening to this program last week, and maybe he's listening tonight. So if you're listening, you know who I am. Your wife is 77, married with your husband, and you met with your daughter. Listen to this story. She was seen at one of the biggest cancer hospitals around. She had only a few standard radiation treatments to the esophagus. She's been left in pain. She has painful liver metastasis. She sees her doctor. She's lost 80 pounds. She's gone from 250 down to 170 pounds. She's lost 80 pounds in pain, on narcotics. She sees this doctor at the cancer hospital, and all he does is, how are you? No treatment. The pain medicines aren't working. The cancer is growing. Wow. Wow. I offered to stage her, to know exactly where the cancer is, and to consider treatment to try to get rid of pain. Our success rate in getting rid of pain for people with cancer is about 90%. It most commonly happens. So for me, it was shocking that this woman going to a famous cancer hospital was left in pain, cancer growing, no treatment. The husband said he just gave her a certificate to die, that's all. So she's coming on Tuesday to be staged up to see where the cancer is. And of course, for every patient is the president of the United States, of their body. They get to choose who should treat them, if there's treatment, and who shouldn't treat them. So We present the facts, and I present them as accurately as I can. I give patients copies of the data. This was all done in a private cancer treatment center, Radiosurgery, New York. It's a private center on 38th and Broadway. We take most insurances, Medicare or Medicaid. We're super convenient, closer, I think, than anyone to all the buses, trains, subways, Grand Central, Penn Station. We have something called the Urgent Cancer Consultants. Just call us at 212-CHOICES, and we promise to see you within one business day. So you don't have to sit home and suffer. We think you should give yourself the most chances. You should have the most choices by calling us at 212-CHOICES. Another example, a woman came to me 4 years ago. She heard about our work. She went looking for me, and by chance she met someone who knew who I was, and I was there. So by chance we met 4 years ago. She has metastatic gynecologic cancer, stage 4. She had chemo in the past. She hates chemo. Now, if she goes to a chemo doctor and say, oh, you have a systemic disease, you need chemo for the rest of your life, she doesn't want it. She has a great quality of life. She's from South America. She spends 2, 3, 4 months a year in South America. If the cancer pops up, she asks us to hit it. If the cancer doesn't pop up, she just goes about her business, and about every 3 months she gets staged up. I just met with her this week. We went through a course of radiosurgery, focused beam treatment, hit the cancer. She's going to take off till August. She's going home for a while, and then she'll be back for staging, see how she's doing. No chemo, doing great, very happy with successful treatment where we attack. And we have another patient who presented to us, a woman that was diagnosed in New Jersey, a black woman, came in with her daughters. She had lung cancer diagnosed at a big hospital in New Jersey, and then went to another hospital, has been on chemo for 9 months. The woman is getting weaker and weaker and weaker. She's breathing is worse. 9 months ago, the cancer was 3.5 centimeters by the airway. Now it's growing. She's having trouble breathing, and she came to me and having headaches. She's still seeing her doctors. She's telling them this, and they're just giving her more and more chemo, and it's not working. So again, we got her completely staged. We listen to the patient. The key is be complete. Don't cut corners. Listen to the patient. Sit down. Close the door. Stay a while. We got an MRI of the brain, multiple brain metastasis, 15 brain metastasis, ignored by others. We found it. Started treatment. Saw her on Friday. She's already better. She's already better. And in addition, we're going to hit that mass in the lung. It's now 7 centimeters up against the airway to shrink it down so that air can pass through her airway into her lungs to help relieve the feeling of suffocation. So she's benefiting most probably from brain radiation to shrink the cancers that traveled through the bloodstream to the brain. That's called a brain metastasis. Started on medicine to shrink the swelling. And we're hitting the mass that's up against the airway with 5 treatments, each one 15 minutes, called radiosurgery. So she's happy. She's feeling better, finally, after months of suffering, and she feels like there's a chance of getting better. And one of the last cases we're going to discuss tonight is a woman whose name is European. She's from Switzerland. She's 80 years old. She had an anal cancer. Again, she went elsewhere, and she came to us. We staged her up. We found that it actually spread to the inguinal nodes. Anal cancer is different than rectal cancer. Usually the pathology is different. Usually it's squamous cell. Usually rectal cancer is adenocarcinoma. The spread of anal cancer is different. It often goes to the inguinal lymph nodes because the origin of the anus is different than the origin of the rectum. So we look in different sites. We actually look throughout the whole body, not to miss something. She just finished a course of focused beam radiation. She had a little bit of chemo with it to help out. And her medical oncologist just called me this week to say that she's in remission. So again, she had a short course of treatment, in remission even before she finishes the treatment. She'll be back. We see patients on a regular basis, even afterwards, just to make sure that everything is A-OK. And obviously, we give our patients our cell phone. They can call day or night to contact us. We believe that patients should have the right to speak to their doctors and to know what's going on day or night, and their families too. So again, this is Dr. Lederman from Radiosurgery New York. We do have a booklet DVD about brain tumors. We have a second one about cancers of the body, and a third one about prostate cancer, which we're happy to send you. If you call us during the work week, Monday through Friday, 9 to 5, we'll get your name and address and pop one in the mail to you. If you have medical questions, you can call anytime. Our number is 212-CHOICES, 212-CHOICES, which is 212-246-4237. That's 212-246-4237. Our next show is on WABC next Saturday morning at 5 a.m. But if you have questions, call anytime. Thank you for listening. Have a great week, and God bless you. Bye.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed, 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 or the ideas